All right. So you can see, as we're looking at Noelle's back here, our lovely model Noelle, that there's already a little bit of bruising in this area, and that's as a result of the cupping that we just did in filming these videos. We had to do a little bit of cupping, and so there's a little bit of discoloration already here on the skin. But let's do some GuaSha and see how that changes. Oftentimes in a clinical setting, we might do some cupping, we'll see some of this redness showing up on the skin, and then say, perhaps GuaSha would be more effective. Oftentimes when you see this color come so quickly to the skin, it indicates that perhaps some slightly more aggressive work needs to be done. In general, GuaSha is more aggressive than cupping in terms of muscle releasing. So I've taken a good amount of some Moxa balm here, which is a very good lubricant. Also, again, very useful for helping to move chi stagnation. So in and of itself, it helps to treat the situation. I've got a GuaSha tool here. This is a plastic GuaSha tool called a GuaShark or a GuaShark. And you can hopefully see it's hard to explain the amount of pressure I'm using here. I certainly can't tell you what it is in foot-pounds, but I'm pressing reasonably. So how does that feel, Noelle? Is that very painful for you?
No.
Not so bad. Okay, good. So you want to use enough pressure so that it actually works. We actually can get this, which is called getting the sha to come up to the surface. And you see what happens is, since I'm using a balm, it keeps coming off on the tool, and I keep putting it back on, which is a good reason for wearing gloves. We can open this up. Now, when you're doing GuaSha or with cupping, when you start to see the redness start to come out, this slight bruising of the skin, you oftentimes want to follow it and see where does it go. If it's just in one area, fine, but we would probably come down a little bit here to see, is it travel down the back? And it seems not. It seems like it's petering out. It doesn't seem to be going up any further from here. See if it goes into the shoulder blade anymore. Yeah, there's a little bit there. See, that's starting to come out. And you'll know, because when you start traveling from the area where the pain is, or the tightness or the tension, that the bruising really comes up just in the most problematic areas. And then as you move away from those areas, we don't really see anything start to come up. And it's not unusual when working with your patient, when you're done, to say, well, I see some bruising right through this area here and nowhere else, maybe slightly in here. And usually the reaction you get from the patient is, well, that's right where it hurts, right in this area. So I think this is a pretty good example. I think we'll move on from here.